What if your own immune system suddenly turned against you, destroying the very cells that keep your blood sugar in balance? Imagine being dependent on insulin for life, not because of lifestyle choices, but because your body left you no other option. This is the harsh reality for millions living with type 1 diabetes. But how does this silent attack begin, and can it ever be stopped? Before we begin, this video is intended for informational and educational purposes only, and should not replace professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for personalized guidance regarding all medical condition. Individual cases may vary, and treatment plans should be tailored accordingly. Type 1 diabetes. Type 1 diabetes mellitus, T1DM, is not merely a condition. It is a lifelong autoimmune disorder that profoundly reshapes the daily existence of those affected. Unlike type 2 diabetes, which is often associated with lifestyle and metabolic factors, type 1 strikes unpredictably, commonly manifesting in childhood, adolescence, or early adulthood. In this form of diabetes, the body's own immune system mistakenly targets and destroys the insulin-producing beta cells of the pancreas, leading to absolute insulin deficiency. The global burden of type 1 diabetes is steadily increasing. According to the International Diabetes Federation, IDF, an estimated 9 million people worldwide are living with type 1 diabetes, with an alarming rise in new cases, especially among children under the age of 15. In fact, research indicates that the incidence of type 1 diabetes in children has been rising by approximately 3 to 4% per year globally, a concerning trend that points to changing environmental factors alongside genetic predisposition. The stakes are high. Without adequate insulin replacement, individuals with T1DM face life-threatening complications such as diabetic ketoacidosis, DKA, a dangerous metabolic crisis. Even with treatment, the disease demands rigorous blood sugar monitoring and lifestyle adjustments to prevent long-term complications, including cardiovascular disease, neuropathy, and kidney failure. In this video, we delve deeper into the causes, mechanisms, clinical presentation, and evolving management strategies of type 1 diabetes, shedding light on a disease that remains incurable but not unmanageable. Signs of type 1 diabetes. Have you ever noticed a child who seems unusually thirsty, constantly reaching for water, even waking up at night just to drink? Or perhaps you've seen someone suddenly losing weight despite eating more than usual, growing weaker with each passing day. These subtle but telling signs are often the body's desperate cries for help. The early warnings of type 1 diabetes. In its earliest stages, type 1 diabetes can be mistaken for a common viral illness or simple fatigue. But the truth runs deeper. As insulin production ceases, glucose, our body's primary energy source, cannot enter cells. Instead, sugar builds up in the bloodstream, causing hyperglycemia, while the body starves at a cellular level. To compensate, the body triggers intense thirst, polydipsia, and excessive urination, polyuria, to flush out the excess sugar. Yet no amount of water can quench this thirst. No sleep can relieve the fatigue. Weight loss occurs despite normal or even increased appetite, polyphagia, because without insulin, the body begins breaking down fat and muscle for energy. Some patients, especially children, may experience blurred vision, irritability, or slow wound healing. If left unrecognized, the condition can escalate to diabetic ketoacidosis, DKA, a medical emergency marked by nausea, vomiting, abdominal pain, rapid breathing, and even unconsciousness. Recognizing these signs early is crucial. If you or a loved one, especially a child or young adult, shows signs of unexplained weight loss, excessive thirst, or unusual fatigue, do not delay seeking medical attention. Early detection can prevent life-threatening complications and lead to prompt, life-saving treatment. Remember, when the body's warning signs whisper, listen. Acting early can save a life. Causes of type 1 diabetes. What if the very system designed to protect your body suddenly turned into its greatest threat? What if your immune defenses mistook healthy cells for dangerous invaders and quietly began to destroy them one by one? This is the hidden and tragic mechanism at the heart of type 1 diabetes. Unlike type 2 diabetes, which is closely linked to obesity, diet, and lifestyle, type 1 diabetes arises from an autoimmune process. For reasons not fully understood, the body's immune system wrongly identifies the insulin-producing beta cells in the pancreas as harmful and mounts an aggressive attack. Over time, this destruction leaves the pancreas unable to produce insulin, an essential hormone that regulates blood glucose levels. But why does this happen? Scientists believe that a complex interplay of genetic predisposition and environmental triggers is to blame. Certain genetic markers, particularly those related to the HLA, human leukocyte antigen complex, increase the risk of developing type 1 diabetes. However, genetics alone are not enough. Environmental factors such as viral infections like enteroviruses, early childhood diet, or even geographical location may act as the spark that ignites the autoimmune response. Interestingly, type 1 diabetes is more common in countries farther from the equator, suggesting that vitamin D deficiency or other environmental elements may also play a role. Some researchers speculate that improved hygiene and fewer childhood infections in developed countries may inadvertently lead to immune systems that overreact to the body's own tissues, a concept known as the hygiene hypothesis. Despite years of research, there is no known way to prevent the autoimmune attack once it begins. However, clinical trials are ongoing, exploring whether early immune modulation can delay or stop the process in high-risk individuals. If you have a family history of type 1 diabetes, be aware of the warning signs and discuss screening options with your healthcare provider, especially for children. Though the cause may be hidden and unpreventable, early vigilance offers the best chance for timely diagnosis and management. Remember, the first defense against type 1 diabetes is awareness. Knowledge can make the difference between crisis and control. Symptoms of type 1 diabetes. Have you ever felt overwhelmingly tired no matter how much you rest? Or watched a child run to the bathroom far too often, drink glass after glass of water, and yet grow thinner by the week? These quiet, everyday changes are often the earliest symptoms of type 1 diabetes, and they are easy to overlook until the situation turns dangerous. The hallmark symptoms of type 1 diabetes stem from the body's complete lack of insulin. Without this critical hormone, glucose accumulates in the bloodstream instead of entering cells to provide energy. The result? A state of energy starvation at the cellular level, while sugar levels dangerously rise in the blood. One of the first signs is excessive thirst, polydipsia, and frequent urination, polyuria, as the kidneys work overtime to flush out the surplus glucose. Despite drinking more, dehydration occurs, leading to dry mouth, headaches, and even dizziness. At the same time, the body tries to compensate for the lack of usable energy by breaking down fat and muscle stores, causing unexplained weight loss, often paired with increased hunger, polyphagia. Yet no amount of food can truly satisfy this hunger, because without insulin, glucose remains locked outside the body's cells. Other common symptoms include extreme fatigue, because muscles and tissues are deprived of fuel, blurred vision, as high sugar levels affect the lenses of the eyes, and slow-healing wounds or frequent infections, as elevated glucose weakens immune response. If these symptoms remain unrecognized, they can progress to diabetic ketoacidosis, DKA, marked by nausea, vomiting, abdominal pain, fruity-scented breath, rapid breathing, and in severe cases, coma. If you or someone you care for, especially a child or teenager, shows a combination of these symptoms, seek medical attention immediately. A simple blood glucose test can reveal the truth. Early detection is key to preventing life-threatening complications and ensuring a healthier future. Remember, in type 1 diabetes, small signs often point to a big problem. Recognize them early, because delay can cost more than time. Before we dive deeper, take a moment to reflect. How familiar are you with the signs and risks of type 1 diabetes? Not just for yourself, but for your loved ones? Early knowledge can make the difference between a manageable diagnosis and a medical emergency. If you find this information valuable, consider sharing this video with friends, parents, or caregivers. You could help someone recognize these life-changing symptoms before it's too late. And don't forget to subscribe for more in-depth, doctor-led health insights that empower you to take control of your well-being. Diagnosis of type 1 diabetes. What if a simple test could uncover a hidden threat, one that's quietly damaging the body before any obvious sign appears? This is often the reality with type 1 diabetes, where early detection can make the difference between life-saving intervention and life-threatening crisis. For many, the path to diagnosis begins with alarming symptoms: excessive thirst, unexplained weight loss, or constant fatigue that prompt a visit to the doctor. But sometimes, especially in children, the condition is first discovered during a sudden and severe episode like diabetic ketoacidosis, DKA. When the lack of insulin pushes the body into metabolic chaos. The cornerstone of diagnosing type 1 diabetes is a fasting blood glucose test or a random plasma glucose test. A fasting blood sugar level of 126 milligrams per deciliter, 7.0 millimoles per liter, or higher, or a random blood sugar reading of 200 milligrams per deciliter, 11.1 millimoles per liter, or more, is indicative of diabetes. But determining type 1 versus type 2 requires further investigation. A definitive diagnosis involves checking for the presence of autoantibodies, such as GAD, glutamic acid decarboxylase, antibodies or insulin autoantibodies, markers that signal an autoimmune attack on the pancreas. In addition, a C-peptide test can measure how much insulin the pancreas is producing. Low or undetectable levels suggest type 1 diabetes. In newly diagnosed cases, screening for diabetic ketoacidosis is critical, particularly in children and adolescents, through tests like urine ketones and arterial blood gases. As DKA can rapidly become life-threatening without prompt treatment, early diagnosis not only prevents acute complications but also opens the door to education, lifestyle adjustments, and lifelong insulin therapy that can help patients lead full, healthy lives. If you or your child are experiencing symptoms suggestive of diabetes, unusual thirst, frequent urination, sudden weight loss, seek prompt medical evaluation. Don't wait for the symptoms to worsen or for emergency signs to appear. A simple blood test can reveal the truth and begin the journey toward effective management. Remember, in type 1 diabetes, diagnosis is not the end. It's the beginning of control, care, and confidence in health. Treatment plan for type 1 diabetes. What if your life depended on a daily medicine that your body could no longer make on its own? For every person living with type 1 diabetes, this is not just a possibility, it is their daily reality. From the moment of diagnosis, insulin becomes not just a treatment, but a life-sustaining necessity. The cornerstone of managing type 1 diabetes is lifelong insulin therapy. Because the pancreas no longer produces insulin, this hormone must be replaced through external means. Treatment typically involves multiple daily injections, MDI, or the use of an insulin pump, a device that delivers insulin continuously under the skin. Both approaches aim to mimic the body's natural insulin release as closely as possible. Insulin regimens usually combine basal, long-acting, insulin, which maintains glucose levels between meals and overnight, with bolus, rapid-acting, insulin, taken at mealtimes to manage the rise in blood sugar after eating. The exact dosing depends on many factors, including age, weight, activity level, and meal composition, and requires careful adjustment and frequent monitoring. But insulin alone is not enough. Effective management of type 1 diabetes also demands a frequent blood glucose monitoring via finger prick tests or continuous glucose monitoring, CGM, systems to track sugar levels and adjust insulin dosing. A careful dietary planning, focusing on carbohydrate counting to balance food intake with insulin needs. A regular physical activity which improves insulin sensitivity and overall health, but must be carefully coordinated with insulin and food to avoid dangerous blood sugar swings. The education and self-management training, empowering patients and families to handle dosing, meal planning, stress, and illness-related adjustments confidently. In recent years, technological advancements like closed-loop insulin delivery systems, the artificial pancreas, have brought hope for tighter control and easier management, but insulin remains the irreplaceable foundation of treatment. If you or a loved one is living with type 1 diabetes, prioritize learning your treatment tools, from insulin types to glucose monitors, and stay in close contact with your healthcare team. Small adjustments make a big difference in preventing complications and living well. Remember, with knowledge, discipline, and the right tools, type 1 diabetes can be managed, not feared. Your treatment plan is not just medicine. It is the pathway to a healthy, empowered life. Implementation. What happens after the diagnosis is made and the treatment plan is designed? How does one turn medical instructions into a sustainable way of life day after day, meal after meal, year after year? For those living with type 1 diabetes, the real challenge is not just knowing what to do, but making it part of daily life. Implementing a diabetes management plan requires commitment, education, and routine. It is not a one-time adjustment, but a continuous, lifelong process that integrates insulin therapy, blood sugar monitoring, nutrition, exercise, and emotional well-being into everyday living. The first critical step is insulin administration. Patients must learn how to properly store, measure, and inject insulin, or manage an insulin pump. This involves understanding basal and bolus insulin doses, adjusting for meals, physical activity, illness, and stress. Modern tools like continuous glucose monitors, CGMs, provide real-time glucose data, helping to guide insulin dosing and prevent dangerous highs and lows. Dietary management becomes second nature over time. Carbohydrate counting is essential, allowing insulin doses to be tailored to the meal content. High glycemic foods, fiber intake, and portion control must all be understood. Physical activity must be balanced with insulin and food intake to avoid hypoglycemia, a real risk during or after exercise. Beyond the biological, psychological, and social factors are key to successful implementation. Parents of young children with type 1 diabetes, teenagers learning independence, and adults juggling work and health all face unique challenges. Emotional support, diabetes education programs, and regular follow-up with healthcare providers make this complex routine manageable. Technology can ease the burden. Insulin pumps with smart algorithms, CGMs linked to smartphones, and even artificial pancreas systems are helping many patients achieve better control with less daily decision-making. If you are implementing a type 1 diabetes care plan for yourself or a loved one, start by mastering the basics: insulin use, glucose monitoring, and carb counting. Lean on your diabetes care team for guidance, and never hesitate to ask questions. Build habits gradually and be patient with the process. Remember, consistency is the key to control. Small, daily efforts in implementing your diabetes care plan can protect you from serious complications and give you the freedom to live life fully. Prevention of type 1 diabetes. Can we stop type 1 diabetes before it starts, or at least delay its onset? For a disease rooted in the body's own immune system attacking insulin-producing cells, prevention has remained one of the greatest challenges in modern medicine. Unlike type 2 diabetes, where lifestyle changes such as diet and exercise can reduce risk, type 1 diabetes currently has no guaranteed way to prevent its development. This is because the autoimmune process begins silently, often months or years before symptoms appear, triggered by complex interactions between genetic susceptibility and environmental factors that are still not fully understood. However, researchers are making strides in identifying high-risk individuals through genetic screening and detection of autoimmune markers, such as islet autoantibodies, even before clinical diabetes develops. This early identification opens the door for experimental approaches aimed at immune modulation, attempting to retrain the immune system to stop or slow the destruction of beta cells. Trials involving immune-suppressing drugs, vaccines, or therapies targeting specific immune pathways are underway, with some promising results in delaying disease progression. Additionally, public health efforts focus on potential environmental risk factors, like viral infections and vitamin D deficiency, though concrete preventive measures remain elusive. In the meantime, awareness remains critical. For families with a history of type 1 diabetes, early screening of children for autoantibodies can enable close monitoring and early intervention, reducing the risk of severe complications like diabetic ketoacidosis at diagnosis. While we wait for breakthroughs in prevention, the best defense today is vigilance. If type 1 diabetes runs in your family, consult your healthcare provider about genetic counseling and screening options. Stay informed about symptoms and seek prompt evaluation if concerns arise. Remember, Though we cannot yet stop type 1 diabetes, early awareness and monitoring offer the best chance to protect health and preserve quality of life. Prevention may be out of reach for now, but knowledge is your strongest ally. Emerging trend insights. The landscape of type 1 diabetes management is evolving rapidly, driven by technological innovation and groundbreaking research that promise to transform patient outcomes and quality of life. One of the most exciting trends is the advancement of artificial pancreas systems, automated insulin delivery devices that combine continuous glucose monitoring, CGM, with insulin pumps controlled by sophisticated algorithms. These systems adjust insulin dosing in real time, closely mimicking a healthy pancreas. For example, the Medtronic Minim 780G and the Tandem T Slim X2 with Control IQ are FDA-approved devices currently available, helping many patients reduce hypoglycemia and maintain tighter glucose control with less daily effort. On the research front, immune therapies are showing promise in altering the course of the disease. Recent clinical trials of drugs like teplizumab, an anti-CD3 monoclonal antibody, have demonstrated the ability to delay the onset of type 1 diabetes in high-risk individuals by several years. This marks a paradigm shift from managing symptoms to modifying disease progression. Moreover, stem cell research is exploring the potential to regenerate or replace destroyed beta cells. Experimental treatments involving the transplantation of pancreatic islet cells or the reprogramming of other cell types offer hope, though these remain largely investigational. Another noteworthy trend is the integration of digital health tools. Smartphone apps that help with carbohydrate counting, insulin dose calculators, and telemedicine platforms for remote monitoring and patient support. These tools empower patients to take greater control of their condition, improving adherence and outcomes. Consider the story of Emma, a 12-year-old diagnosed with type 1 diabetes, whose family embraced the use of a hybrid closed-loop system combined with a smartphone app. With these tools, Emma's HbA1c levels improved significantly, and her risk of hypoglycemic episodes decreased, allowing her to participate confidently in sports and school activities. While challenges remain, such as cost barriers and access disparities, these innovations collectively represent a hopeful future where type 1 diabetes management is more precise, less burdensome, and tailored to individual needs. Type 1 diabetes is a complex, lifelong condition that demands vigilance, knowledge, and dedication, not just from patients, but from families, caregivers, and healthcare providers alike. While it remains incurable, advances in treatment and technology are steadily improving outcomes, offering hope and empowerment to millions worldwide. If you found this information valuable, take a moment to share it with others. Raising awareness could save lives. Whether you're living with type 1 diabetes or supporting someone who is, remember, early recognition, consistent management, and access to the latest therapies make all the difference. Stay informed, stay proactive, and connect regularly with your healthcare team. Together, we can turn a diagnosis into a journey of control, resilience, and health. Subscribe to our channel for more expert insights on chronic conditions and breakthrough treatments. Your health is worth it.